Since opening up to sports betting in 2019, Illinois has rapidly emerged as one of the top gaming markets in the nation. The Illinois Gaming Board says residents wagered $7.1 billion last year alone. And now, just in time for March Madness, Illinois has dropped an in-person registration requirement for sports bettors, making it even easier to gamble using online apps. But the expansion of gambling is not without cost. Joining us now to talk about the issue of problem gambling are Daniel Trellarow, Vice President and Gambling Prevention Specialist at Epic Risk Management, a global consulting firm focused on minimizing the harm caused by gambling. Trellarow is himself in recovery from a gambling addiction. And Dr. Teresa Garate, Senior Vice President at the Gateway Foundation, a nonprofit that treats many kinds of addiction, including gambling. Thanks to you both for joining us. Dr. Teresa Garate, let's start with you, please. How much has problem gambling increased since Illinois legalized sports gambling or sports betting in 2019?
So, and Dan will probably tell you about this, it's very difficult to measure how many people suffer from a gambling disorder because it's very difficult to see it as opposed to a substance use where we have data from hospital overdoses, emergency room visits, et cetera. But we know in Illinois that the need has grown because one of the ways that Illinois has responded to this increased opportunity for gambling is by providing resources to extend more treatment facilities. So Gateway was one of those facilities that actually received funding for the first time because they realized they needed more providers to be able to treat the increasing number of people with a gambling disorder.
Daniel Trellarow, just in time for March Madness, the state has made it even easier for people to gamble online using apps, and they've made it easier by dropping this requirement that people have to sign up in person at a casino. What's the impact of that going to be?
Yeah, it's interesting as we see gambling and sports betting in particular expand around the country. We're seeing availability, as you mentioned, and accessibility to be two of the areas of concern. With that said, we generally know that gambling can be enjoyed by many people without developing a problem. But problem gambling exists along a continuum. And as Dr. Garante says, it's hard to identify those who experience gambling-related harms. When someone can go sign up, they're now gambling for the first time. Perhaps they wouldn't have done this last year or a couple years ago. So now you're introducing this opportunity. And for some people, that opportunity can be the launching pad into problem gambling throughout their life.
Teresa Garate, in 2021, Illinois residents wagered more than $7.1 billion. How much more is this market likely to grow with a Chicago casino in the works, as well as the state making it even easier to bet online on sports?
Well, I think obviously we can't predict the future, but already Illinois has more video gaming terminals than any other state, including Nevada, in the country. So this was already a growing problem. Now I think it's going to be exacerbated. The planned casino in Chicago, I think is also going to bring some more attention to this issue. And hopefully some of the revenues and the benefit of that will be invested into treatment and most importantly, prevention and education, because something that Dan said is very important. All addiction is a disease of the brain, whether it's a process addiction or a substance use issue. And so the more we can educate people that gambling is, that you can develop a gambling disorder, the better we will be able to support people. One of the biggest challenges around gambling is that people don't see it as, oh, I'm not going to get addicted to that. It's not like alcohol. It's not like anything else. But that is really a myth. It definitely is dangerous and it can happen.
And to that point, Daniel Trellarow, lots of people can gamble without gambling becoming an issue for them. But how would you define problem gambling or a gambling addiction?
Sure. Like any addiction, but even with substance use disorder, when it starts to create negative impact in an individual's life, and there's so many warning signs along the way and so many various ways to kind of measure. The diagnostic manual, DSM-5 in 2013, actually identified gambling as a formal disorder on par with substance use disorder. And some of the telltale signs is the preoccupation, the chasing of your losses, the lying to those who are close to you, relationship issues, and even performance and productivity issues, whether on the field or in your job or even at home or even in school. When they start to take a toll, that's when you know it's starting to become a problem. And I think Dr. Garate was right. We don't see gambling or treat gambling the same way as substance use because it's not something that smacks us in the face. There's no positive urine screen for a gambling disorder. There's also no federal funding for gambling disorder. It's done at the state level. So state by state, as gambling expands, we need to be creating education, having conversations just like this during Problem Gambling Awareness Month, as well as beyond, to identify what the concerns are and how best to treat and address them.
And Teresa Garate, what are the most effective ways to treat a gambling addiction?
Well, the first thing I think is to make sure that people understand that there's stigma associated with any kind of addiction. So the more that we can talk about it in opportunities like this, the better. People should know that suicide is 5 times more likely among people with a gambling disorder. Again, 5 times more likely with an issue in a time where we already have an issue with suicide and mental health issues. So the best way is make sure you talk about it. Make sure you people that you love, that you think may have some issue, know that there's treatment out there. There's a great website. We Know the Feeling. It's a national website. People can go on there and access information. Gateway has our own resources at our website. But the best way is to do an assessment, make sure that you understand how gambling is affecting you, your biosocial person, who you are, and then get the treatment that you need, whether it's outpatient, one-on-one counseling, whatever it is, but treat it like a disease, which is what it is.
And sticking with you for last question before we go, Teresa Garate, the sports book has gross receipts, the money that they keep after winnings have been paid out, of $525 million. Now, the state received $79 million in tax revenue, $6 million went to Cook County. What do we know about how much of that money is earmarked for treatment programs?
Yeah, so unfortunately, I am not at the state, so I don't know exactly, how that's going to work out. But what I can tell you is what I shared at the beginning, is that we are a new provider to this work. We have been around for 53 years doing addiction treatment in the best way possible. But in the last few years, we were asked to join and also provide services. So there is definitely a desire from the state, at least at the state of Illinois, to use a lot of that money to create more opportunities for people to have greater access to treatment close to their home, virtually or in person.
Okay, that's where we'll have to leave it. My thanks to Daniel Trellarow and Teresa Garate for joining us.